testing is completely different. He's still weak than him. So what is the difference? Look at him. No. What's the difference? Right from the test, you can see a completely different condition. With him, the arm was weak. But here, got it? Means that maybe thorax is unstable and it is tertiary. Let me tell you the one. This is strong. And this is weak in this position. If I stabilize the thorax, this is strong. Means that these muscles here are tertiaries. If I this again, it's weak, split apart the muscles, now it's strong. It's still stable because it's primary secondary. But tertiary becomes strong. Then in this case, these are tertiaries. In this case, the problem probably is not coming from here. The problem comes from the spine. Did you see his position was with the legs open? Very often it's because they have a problem with the abdominal muscles and they need to compensate with adductors. Rotation. Okay, look at, do you see the difference? In this case, okay, if I hold the leg, it's strong, this chain. If I hold the other leg, it's completely weak. Got it? What happened here? The thorax is unstable, but the problem comes from the legs. Because he is weak all the time, but here or there, whatever, keeps it strong, keeps it weak. Probably could be abdominals or thorax or whatever. But in this case, just because I touch here, become weak and there it doesn't. UTL. Doesn't help. It's not a kinematic chain. Then where is the problem? Immediately, as soon as I hold here, it's strong and stable. As soon as I move down to the leg, I'm weak. Could be something here. You know? Ready? Hold on. I suggest to him to do some exercise because he's very weak. I have good physios, but maybe you have good diet and exercises. Nice. The left one is really strong and heals very well. No problem with the left one. That's why when I hold here, it's stable. Now he's a switch. In this position, give me further. Paralyze. Yeah, no switch. It never fail. No more. more switch.
It's so stressful to the patients.
So what?
It's so stressful.
It's a stressful for the patient, yes. Then, what happened? What caused switch when he lay down in the table?
Maybe compress something.
I didn't compress nothing.
No, but when he lies down.
He is sitting now. He is compressing the sacrum. Now, what made the difference? Probably we're going to look for compensation or for more problems. This is non-monotonic. Now this is strong. And now the switch. The neck. As soon as you move back, is the neck. Becomes switch for the neck. Now, can you feel it? You can follow me. This is what you need to see in every single patient.
Just in the arms to begin with. He did this.
That's why. Because he has a little more stronger and no switch. Here he has a switch and problem. Okay. If I push forward, the neck is lower weakness. Backward, strong. And the strong. Then all the problem come from the neck. We want to see the skills of Christian. Fight the problem with the neck.
At least I agree.
Oh wow, thank you.
Lavede du dobbeltstemt?
Nej, jeg vil bare se, om jeg også fandt, at han blev switched. Prøv lidt dobbelt.
We're going to do this again.
If you go switch, so I have to find something else.
WDL?
Yeah.
Give him the card. Look for what is this?
Forstår I, hvorfor jeg gjorde det? Fordi når stimmeren bliver switched, så jeg prøver at se, om jeg kan låse ham ind, og så finde noget, der jeg kan blive ham ud af.
Så er han switch lige nu?
Ja, kigger på X.
What are you looking for? Receptor, mechanoreceptor, what are you looking for?
Right now, I was trying to see if there's other ligaments involved in the.
How do you know it's ligament? If you know ligament, why to look for ligament?
I don't know. I just
How
felt
can
like
you know it's ligament or not?
what I just found, or
We found it, I found. How do you know it has ligament problem? What is the problem?
well, the original stimulus is.
We don't care about the stimulus. When you do that, could be you are stretching the ligament, maybe you are doing any kind of stimulus with this one.
If it's primary,
How can you know is ligament is Golgi the problem or not?
I can do the pairing, or I can use TS line. It's
The pairing, but you don't know where is it? How to pair?
The same
You
thing.
don't know where is it? How to pair?
I don't understand your question.
Okay, you say I pull, but still you don't know if it's Golgi or not.
Yeah,
Could be many things.
yeah.
How, the question is, how do you know if the problem comes from Golgi or not? Example, is that keeping the chain? Does it help? Gone. No. How do you know if it's Golgi?
Well, if it's the movement,
Okay,
then it should be gone.
that's right, you are right, it's TL. Yes line.
Yeah, okay, I said that.
When do you say that?
He did.
You did.
Yes.
Okay, do it.
The what?
TS, use the TS line.
Okay, now he's normal, I think.
Okay, make him switch.
Only
WTO. Now, there's a switch. Now, steam the TS line on the right side.
Yeah.
This again. Lines. Now, if it improves, means the
Primary
Golgi is primary. Not necessarily it's priority, but it's primary. Now, we don't need to look for other dysfunctions. We need to look only for Golgis. Where is the Golgi?
Exactly.
Exactly, millimeters. Not millimeters.
It's going to be probably the ligament around the what's it called, odontoid.
Why? There.
This is the
When you do that, you make a lot of things, and you probably do more than 20.
I can see if I can help it from
Okay.
the outside.
Do it. WTL. Switch. Now we move only one finger, only lines. We want to test the algorithm with one finger, looking for specific areas, look for the Golgis. Should be, most of the time, it's going to be the first 2 or 3 vertebrae, around 2 to 3 vertebrae. With one finger. Good. Or rub to see if it helps temporarily. Yes.
Okay.
Now,
So it's
again switch. Yes. With one finger try to find it. Got it. Now send this Golgi to basic mode. No, with your finger. Exactly where you find it. Okay. Now test the lower dysfunction.
which was
Connie går så for noget mere til.
Weak. Then you don't do it properly. Find the body.
oh, it's not in the same fraction.
Right there?
Good.
Good. Yeah. Okay, now test it. Do it again. Do it again. Now, here is the Golgi. Yes? Now from here go to primary priority.
Okay.
Triple stem, WTL.
Yeah, okay.
Find the proper receptor.
Good touch.
Good touch.
Yeah.
Okay, WTL. For good touch.
Okay. Reaction tools. Okay, good touch. Yeah.
Good touch.
Mm.
This is primary priority. Clear?
Så et af kæbeligamenterne, hvis I ikke ved, hvad det er.
Hvordan fandt du primary priority derfra? Forstår ikke helt.
Lukker ham ind. Så good touch.
Ah, selvfølgelig. Ja.
Stærk, permanent.
Questions then now? This is how we are going to work. Maybe the problem comes in the shoulder, but could be in the shoulder, could be in other place the problem. Yes.
When you use the TS line, you can only use it if it's Golgi, right?
Okay.
If not,
If I have a patient is weak in the clearance, and you steam the TS lines and becoming strong, primary is going to be the no priority, not necessarily priority. Primary going to be Golgi.
yeah, only joint.
Only Golgi. Now you know it. Or sometimes you have a strong muscle, and you don't know really if it's associated with Golgis. Rub them and become weak. If you become weak, the same thing. With this technique, you can be sure or discard the probability of Golgi like a primer. It helps a lot because Golgi are is a very, very common dysfunction. Another question? Easy? Now we are going to look at a patient who has a lot of problems. But now we need to know how to treat the patient completely. He has a problem here or there. Now we need to find the priority. 3 days ago in my office, I have a patient who has been with lower back pain for more than 3 years. And pain in the leg in this area. I said to for the problem, I found paleo in the sternum with the tectum secondary. My thing was look there, done. Immediately the pain disappeared in the legs. He can magic things. Sometimes we can make magic. Sometimes we can be so stupid. But at that moment it was magic because with a very simple stimulus in the chest, disappeared the pain in the leg.
Did he have in his history something that told you?
Nothing. In this case, nothing. I found this one just by visual diagnosis and testing. He has no idea. I asked him, do you have any trauma here? No. At least he cannot remember it.